examination done, and they gave me a sample of my blood. A sample of my urine.
Okay.
And it was the doctor noticed there was a blood in my urine.
Okay. What's your question?
The question is, since I live over here in Bayside, okay, and sometimes it would be bad weather, I couldn't get over there.
You can get over there. There's 150,000 people who take the Long Island Railroad. There's millions of people who take the subway every day. If you have blood in the urine, it could be a sign of cancer in the bladder, cancer in the ureter, cancer in the kidney. You need medical attention. You're welcome to come to us. And if you don't want to, you don't have to. It's your free choice. You're the president of the United States of your body. You get to choose. Yes, sir.
Okay, when there's blood, you mean you can physically see blood, or could be blood without me seeing it?
You don't have to see it. It can be microscopic blood. So it doesn't have to be cancer. It could be an infection. It could be kidney stone. There's a variety of things that it could be, but you need medical attention. Definitely.
Okay, let me ask you this question. Well, I can't take the subway because I have a cane. I have to carry around with a cane, okay? And I live, what I know is a bus. And I live near Whitestone over here, Bayside, Whitestone. And there's a bus. And the bus doesn't go to...
Okay, why don't you just call us after the show? Call me at 212-CHOICES, which is 212-246-4237, and we'll talk about logistics. But it's very important you get medical care, and I'm glad you called. So call me later, 212-246-4237, and we'll talk about all the logistics for you to get the best possible care, okay?
Okay.
Thank you, and God bless you. Bye-bye now. Okay, thanks for that caller. And again, it's best to call us directly. The best line so you can hear is at 1-800-321-0710. Bob or Ed will take your call, 1-800-321-0710. This is a live program, and our goal is to take your questions, answer your questions, and provide information to have a better life and a better health. We're going to hear from our sponsor, and we'll be right back after this word.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based upon PSA, Gleason score, and stage. That's why Dr. Lederman's custom tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results. Avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid, accept it. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super. In Manhattan at 38th and Broadway. Custom tailored treatment to hit the cancer. Call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman. 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and we have another caller on the line. Hello, this is Dr. Lederman. You're on the radio.
Dr. Lederman, I'm on the radio. I just turned the radio on now, 7:10.
Okay, what's your question?
This is the question now. What if you have blood in your stool?
Blood in the stool, like blood in the urine, can be a very serious sign. Look, it could be from hemorrhoids, it can be from fissure, but it also could be from cancer. And without looking, you don't know, and we have many, many patients who were told, oh, it's just hemorrhoids, and it turns out to be cancer. And I have one patient who I talk about regularly who was told for 3 years it's hemorrhoids. No one ever looked. It turned out to be a rectal cancer with spread to the liver. So blood in the stool is a serious sign, just like blood in the urine.
Yeah, because it's probably like once or twice a month, 3 times a month.
Well, it shouldn't be happening.
A little blood. It's like blood.
Well, you should come in, check us out, let us check you out, and try to find the source of the blood to make sure it's not a cancer. It could be an early warning sign for cancer, and obviously, if it is cancer, it can be treated, but you need to know what the cause is. You can't guess.
Yeah. Where are you? I only have Medicaid. That's my insurance.
We take most insurances. We take Medicaid. We take Medicare. So just give us a call at 212 Choices. Our address is 1384 Broadway, 1384 Broadway on Broadway and 38th Street in the heart of New York City by Macy's and by Times Square.
I'm from Jersey, though. That's okay?
Just call the number and speak to the girls. Call the 212 Choices number, okay?
All right, I appreciate it.
Thank you. God bless you, and good luck.
You too, bye.
So, can blood be a warning sign? Yes. Losing blood in the urine, losing blood in the stool. It's not normal. So if you're losing blood in the urine, in the stool, if you're coughing up blood, if you're a woman and you're losing blood when you shouldn't be losing blood in the vagina, from the vagina, give us a call. These can be warning signs. It can be terrible warning signs. They might be early warning signs, and you may save your life. And it may be nothing serious at all. So again, give us a call during the work week or after this show at 212 Choices. During the show, call us at 800-321-0710. But please, don't ignore early warning signs. They may save your life. And, of course, having colonoscopy is very important for every American. And for others, blood in the urine, while there's no routine testing, please follow the advice. And it doesn't have to be blood that you can see. It could be microscopic blood that's detected with a dipstick. So when you're getting a urinalysis, a dipstick is put in the urine and tells us if there's blood, even microscopic blood. So very important, very critical question. I just want to talk for a moment about this Ebola situation. There's an article in Wall Street Journal, and I think most people aren't aware that 2 entire schools in Ohio are closed. Why? Because there were a teacher from that school was on the plane that carried the nurse, Miss Vinson, the nurse that has Ebola. Well, no one knows what the contact was, so the nurse was on the plane with the teacher. The teacher works in 2 schools in Cleveland. Both schools are now closed. In Texas, 3 schools are closed because 2 students were on the same plane as that nurse. 30 miles east of Dallas, schools in Royce City, schools were closed because the students were in contact with the nurse who had Ebola. 13 nurses from Ohio hospitals were on the same flight. 13 nurses. They're all on paid leave. Frontier Airlines put 2 pilots and 4 flight attendants on leave for 21 days. So is Ebola affecting people? Yeah. Why? Well, number one, very contagious. We don't really know how it's spread. Obviously, the government isn't content to say it's only direct spread of materials from one person to another. We've been constantly reassured. On September 30th, the head of the CDC said, quote, "We're stopping Ebola in its tracks in this country." He said the United States would halt Ebola in its tracks 6 times. Then on October 6th, President Obama said that the CDC, the Center for Disease Control, had protocols to greatly reduce the risks of anybody catching this disease. He said on October 6th, "We know what has to be done, and we've got the medical structure to do it." So now there's 2 Dallas nurses who cared for the first U.S. patient have been infected. So obviously that reassurance wasn't true. We didn't stop Ebola in its tracks. We seemingly don't know what to do. The CDC wants to interview all the passengers who are on the flights with those nurses to and from Cleveland. Excuse me, we have another caller on the line. Hello, it's Dr. Lederman, Radiosurgery. You're on the radio.
Did you say, I just called you, did you say that after the show you can...
After the show, call us at 212-CHOICES, 212-246-4237. Thank you. Bye now. So, it's clear that while we've been reassured, hospitals and staff didn't know what to do. They even allowed a nurse who had Ebola and who was exposed to Ebola on commercial flights. So people's lives are at stake, said Representative Congressman Fred Upton from Michigan. Another Congressman, Diana Gillette from Colorado, said it would be an understatement to say that the response to the first U.S.-based patient with Ebola has been mismanaged, causing risk to scores of additional people. 3 weeks into the crisis, health experts outside the government say federal officials erred in their opinions and their statements, and that public trust has been frayed. The White House said, though, now the White House said this last Wednesday that there's going to be more cases of Ebola in the United States, and they finally acknowledged the shortcomings in their administration's response. The White House spokesman said that the second nurse's infection showed that clearly something unacceptable occurred. Now remember, on September 2nd, the head of the CDC spoke about the growing Ebola outbreak, and the CDC had alerted medical personnel throughout the United States to test for Ebola if patients had traveled to those countries. Yet at this hospital, Presbyterian Hospital in Dallas, Mr. Duncan, who had Ebola, was sent home even though it was known he came from Africa, and he had a temperature of 103 degrees and other symptoms. And then, 3 days later, on September 28th, he came back to the hospital by ambulance with more serious symptoms, was admitted, and then died. 2 days afterwards, the CDC chairman, Dr. Frieden, said, one of the things we want to emphasize is virtually any hospital in America can do isolation for Ebola. Well, the first hospital couldn't do isolation effectively with 2 nurses getting Ebola. So again, reassurance that wasn't true. And he said, the head of the CDC said, the issue is not that Ebola is highly contagious. The issue is that the stakes are so high. That's why the hospital in Texas is taking all the precautions they need to do to protect healthcare workers caring for this individual, which didn't succeed. So it's easy to see why Americans don't trust the administration and don't trust all this reassurance. As soon as the government says don't worry, I think the real word should be worry. Dr. Frieden said on October 5th, we have no doubt we'll stop it in its tracks in Texas. And then 2 days later, he said there's signs of real progress in Dallas. But then, 2 days later, the first nurse who took care of Mr. Duncan got Ebola. And then several days later, another nurse got Ebola. And both of these nurses were wearing protective gear. So obviously, who's in charge? There's something wrong. Dr. Aha from Harvard Medical School said, oh my gosh, it's getting worse and worse. Who's in charge? Just because hospitals should be ready doesn't mean they are. That's why the messaging has changed. But for the general population, there's an increased feeling of no one knows what's going on. And that's why we talk regularly about hospitals and infections. Just for regular people, not Ebola, there are 750,000 infections caused in hospitals, and 99,000 people, like possibly you or your loved ones, die in the hospital from lack of hand washing. So I guess when people die in the hospital, I say, oh, he died of an infection. But now what's happening is the nurses are getting it, and it's a sign of how we don't really practice in hospitals diligent care to prevent infections. And that's why I talk so frequently. If you can stay out of a hospital, you should stay out of the hospital. If you can avoid surgery, stay away from the surgery. That's why we do our work in an